Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. This episode features Dr. Jill Blumenthal on PrEP considerations for transgender individuals. Dr. Blumenthal is an associate professor of medicine in the Division of Infectious Diseases and Global Public Health in the Department of Medicine at University of California, San Diego in San Diego, California. For the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Blumenthal has to say about providing PrEP to transgender individuals.
Hi, everyone. Today I get to talk to you about PrEP considerations for transgender and non-binary adults and how to bring in gender affirmation to that process. When we think about PrEP for transgender individuals, it's really key that we also focus on what's most important for transgender individuals. I'm also throughout this talk going to say transgender when I'm referring to the broader umbrella of transgender and non-binary, gender diverse individuals. So we know that barriers exist to PrEP uptake for transgender individuals. And one of the really important things is not only lack of access to healthcare, but even when healthcare is accessible, the desire to want to use healthcare because of prior experiences of discrimination and stigma. The other thing that transgender individuals who are taking hormones, they may be concerned that any medication that they're prescribed outside of PrEP, but obviously including PrEP in this situation, could interact with their hormone therapy. Those are two things to always bear in mind when you see a patient in your office. And really, if we're going to effectively get PrEP to transgender individuals, obviously with the patient in front of you, that's the one person you have to worry about. But if we're going to effectively do this for lots of transgender individuals, we have to bring them into the conversation to find out what works for them and what they need. But then the part that we can do is to make sure providers understand how to provide gender affirming care. And so what does that mean? When I say gender affirming care, what does that look like? And some of it is so straightforward and easy. It is the very beginning is making sure that you use the patient's chosen name and pronouns and asking that when you meet them, or having front desk staff when someone comes to the desk, ask that, or if someone's calling in to register, to ask those questions. That also then makes the assumption that your electronic medical record follows that along, which isn't always the case. So sometimes EMR updates are necessary to make sure all of these pieces fit. And this is what a provider can see and what anyone that's accessing the EMR actually sees about it. It involves establishing a trusting patient-provider relationship that may take time. It isn't something that happens necessarily in the first visit, but some of the things that you can do to make a transgender individual feel more comfortable is really just show that you're an ally. And very easy ways to do that. You can have a trans flag on your shirt or near your badge, have your pronouns available for someone to see, have brochures and posters in your clinics and waiting rooms that reflect different trans identities. Obviously, that has to be authentic, though. You can't have those things and then not offer that kind of care to patients. But if it is something that you do and that your office is able to do, those are just some friendly ways to make patients feel more comfortable and for them to feel affirmed with their gender. It's important to promote gender relevant patient education and overall health with patients. And that can look like a lot of different things, but it really is focusing on what matters for their gender health, but also anything that is related to their sex assigned at birth that's still relevant from a screening or a treatment perspective is also important to acknowledge. And then the other thing that you can do when you see transgender individuals are use gender neutral terms whenever possible. When I see patients and I'm starting the more sensitive part of the visit, which often includes talking about sex, I will ask them if there is a way they'd like me to refer to their genitalia outside of the standard way that we do it with penis and vagina. And patients will be able to tell you that. The other one that I like to make sure I'm talking about, especially if you're seeing transgender men or masculine, transmasculine, non-binary individuals, may not want to talk about their breasts and may refer to that as chest. And there are other examples where you can use more neutral language that will make a patient feel more comfortable. So one of the big things that providers can do to facilitate gender affirming care is integrating the provision of hormone therapy as well as other referrals for surgeries or other procedures that affirm people's gender along with PrEP. So that probably is easiest in a primary care setting where someone is coming to establish care just for their general health. And within that, they may be asking about hormone therapy. And then that can be a good segue to take an appropriate sexual history. Vice versa, you're in a primary care setting, someone comes in and is asking about PrEP, who identifies as trans. You may say, have you thought at all about any gender health care? And I've had experiences, fortunately, where both things happen, where someone is coming to see me specifically for PrEP and doesn't know that there are options for them and affordable options for gender health. And some patients are seeing me specifically for gender health. They're coming to be prescribed hormone therapy. And then when I take a sexual history, learn that they would be an appropriate candidate for PrEP. So that's an easy setting to do it in. I would make the argument, though, for transgender individuals who may show up outside of primary care doctors. So in an endocrinology office, it would be really important to take at least a basic sexual history and determine if someone might be appropriate for PrEP. And if it's not something that provider can prescribe themselves or feels comfortable, at least knowing who to refer to. The other parts of how to best facilitate gender affirming care are having access to, or at least being knowledgeable about, wraparound services that trans and non-binary individuals may need. That may include housing resources, case management, mental health and substance use treatment, and legal support for various arenas. I recognize that may not all be possible within a particular setting. But again, as long as you are aware of resources and as much as you can make warm handoffs, that is very helpful for patients. And this probably can't be said enough. I think one of the biggest parts of gender affirming care that I've seen is really just not having judgment for any patients when you see them. For a lot of transgender individuals, the health system hasn't always been welcoming, and not only not welcoming, actually discriminating. And we hear about refusal of care. And what I've learned has made transgender and non-binary individuals feel as comfortable as possible is listening to them, making sure that they know that I'm hearing them. And again, coming to appointments without having any judgment for them. So as I talked about before, if a trans person is coming seeking PrEP, you're going to be taking a sexual history regardless. But that's not always why someone is coming to see you. But if it's something that you're able to get to, it's really important and very helpful. And the way to remember this broadly, and you may not be able to get to all these pieces, are the 6 Ps of taking a sexual history. It used to be 5, and there has been a movement to add a 6th one. Those 6 Ps are asking about partners, people's practices, past history of STIs, protection from STIs, pregnancy plans, And then there's Plus, which is meant to include a variety of additional things. And some of those things might be asking about past trauma or intimate partner violence, any sexual concerns or problems, and then any questions about sexual satisfaction. This also might be the area if you are seeing a patient for PrEP, where you would actually ask a little bit more about sexual orientation and gender identity if you hadn't already done that before. And what I like to tell other providers and particularly trainees that I work with is that we should never assume gender identity, pronouns, sexual orientation of a patient or their partners and types of sexual activities that they're engaging in. You can't guess. A lot of people make assumptions, but asking people, finding out what they do is the best way to do it. And some of the easiest ways that a person can do that is just asking, what types of sex do you have? Who are your partners? So can you tell me about the gender identities of your partners? And then sometimes most basically and straightforward are what body parts are used during sex if you are having sex. And I do like to remind people, especially with younger people, but people who are maybe new to their sexual expression, some transgender individuals, it's something that as they go through their gender affirmation may start to become more comfortable with their body and start to explore it. So it's important to remember that people who maybe just engaging in oral sex or just engaging in something that typically can't cause acquisition of HIV, but potentially STIs that could be acquired, that may be someone who is a good candidate for PrEP, even if they technically in the moment aren't engaging in behaviors that would put them at risk for HIV, because it might change. And we know that from studies where, again, particularly young people, but you could apply this to people who are new to their gender identity exploration, their bodies are changing, that one behavior may beget another behavior. Thinking about PrEP, certainly talking about it with anyone who is sexually active. And to me, that really means all forms of sexual activity. It should be something that is discussed. The other thing with transgender individuals and really anyone, I think the sex positivity approach is a very good one. And we want to ask people about how their sexual function is and was sex pleasurable for them. We don't only want to focus on risk. And I think when you're able to do that, that can open up patients to talking about their experiences more comfortably. The other very important part of this that I talked about earlier is making sure that patients are aware upfront that PrEP has not been found to diminish the effectiveness of hormone therapy. And that's testosterone, that's estrogen, that's androgen blockers. And that in the other direction, hormone therapy doesn't affect the clinical efficacy of PrEP. There have now been a lot of studies that keep showing this finding, and it's been shown in all of the PrEP regimens. The most data that we have is for M-tricidabine, tenofovir, disoproxil fumarate, where there are multiple studies that have shown no clinically relevant bidirectional effects. There's a very small study for M-tricidabine, tenofovir, alafenamide, which showed similar concentrations of tenofovir between trans women who were taking hormones and men who have sex with men who obviously weren't taking hormones. And there's also data out about long-acting cabotegravir and hormone therapy, which shows no interactions as well. So this is all very reassuring for patients, and it's something that I like to let them know up front, regardless of what PrEP regimen is selected, they can feel assured that their hormone therapy won't be affected from the data that we currently have. What's also really exciting now as we talk about PrEP, we have a lot of options. Several years ago, the only thing that people could get was TDF. And now I'll talk about transgender women to begin with, because that's where we have most of the data so far. So transgender women have been included in studies, and it's shown to be effective that they can take daily FTC TDF, daily FTC TAF, and then long-acting cabotegravir. Transgender men, it's been shown that that daily FTC TDF and long-acting cabotegravir would be effective. And what's not listed for transgender men is daily FTC TAF, which hasn't been sufficiently studied in people who are engaging in vaginal sex ed. And that data will be forthcoming at some point, but right now it's not currently recommended, although I definitely know providers that will do that if a patient isn't tolerating FTC TDF or long-acting cabotegravir, but that's a much newer drug, and there are more barriers to getting that medication approved by insurance companies, having it available at various clinics. But these are the 3 different medications that are available, which is wonderful to say that there are options. I will make a note that while on-demand or 2-on-1 PrEP has been studied and shown to be effective in cisgender gay and bisexual men, the same studies have not been done for transgender women. And because of the effect of hormone therapy, not changing clinical effectiveness, but potentially lowering the concentrations of tenofovir just a little bit, that might be enough that if you're not taking it daily or close to daily, it could be more concerning. I hope that there will be studies looking at that as well in transgender individuals, because having a 2-on-1 option would be excellent for that group as well. So really, my final point, if you're going to take anything home from this, is that HIV prevention and PrEP should be discussed with every sexually active transgender individual. That means that some form of sexual history should be taken on every transgender and non-binary individual, and a non-judgmental sexual history should be part of the social history that's taken. There are several different PrEP administration options available for transgender individuals with essentially no concern for interactions with the hormone therapy. And the ways that we can really ensure that patients feel comfortable with us and want to get their PrEP with us is being able to provide hormone therapy yourself and creating a welcoming environment that transgender individuals feel supported in, where they can receive all of their care. Thank you so much for joining me today.
Thank you very much to Dr. Blumenthal, and thank you to our listeners for joining in. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.